Welcome to this training session for healthcare professionals in Malawi. Today we are considering hearing loss, how to prevent it, how to recognize red flags, and how to use simple World Health Organization screening tools. By the end, you should feel confident counseling patients, detecting problems early, and knowing when to refer. Hearing loss is a growing global health challenge. The World Health Organization estimates that by 2050, nearly 1 in 4 people worldwide will have some degree of hearing loss. In Malawi, around half of the cases of hearing loss are preventable. Some children suffer from chronic ear infections, untreated illnesses like measles or meningitis, or exposure to loud noise. Older adults are affected by age-related hearing loss, which can lead to isolation. Specialist ear and hearing services can be scarce, especially outside central hospitals. Hearing loss can happen at any stage of life. In children, infections like measles, mumps, or meningitis can damage the ear. Untreated ear discharge or otitis media are some of the most common illnesses you'll see in the clinic. For older children and adults, ear health can be affected by wax buildup, glue ear, and exposure to loud noises from minibuses, music systems, grinding mills, or factories, which can gradually harm hearing. Some medicines, such as streptomycin, quinine, or chemotherapy drugs, are toxic to the ear. Complications during pregnancy and birth, head injuries, aging, and inherited conditions can also impact hearing. Not every case of hearing loss requires specialist care, but some situations are too serious to handle alone. Sudden hearing loss in one or both ears, ear discharge that has lasted more than 2 weeks, severe ear pain with fever, facial weakness linked to an ear problem, or a child who doesn't respond to sound and has delayed speech. These are all red flags. They need urgent referral to a higher level facility.
Vaccination against measles, rubella, and meningitis is one of the most effective measures to prevent hearing loss. Safe deliveries and good antenatal care help reduce birth-related complications, and health education is key, such as reminding families never to put objects or liquids into the ear.
When problems do arise, early treatment is critical. Prompt care for ear infections and screening of high-risk groups such as HIV or TB patients and premature babies can prevent permanent damage. For people already living with hearing loss, rehabilitation through hearing aids, speech therapy, where available, or sign language can transform lives and keep them connected to their communities. Simple advice can go a long way. Remind families that the ear cleans itself, so there's no need for cotton buds, feathers, or sticks, which can push wax further down or harm the eardrum. Pouring oil, breast milk, or herbs into the ear is harmful and should be discouraged. Keep ears dry after bathing and avoid swimming in dirty water. And always seek care if there is ear pain, discharge, ringing, or sudden hearing loss. In noisy environments, protection is vital. Earplugs, headphones, earmuffs, or even cotton wool is better than nothing. Early detection saves futures. The World Health Organization has made screening easier with the Hear Who app, a free smartphone test for people aged 16 and above. There are also simple screening questions. Do you struggle with conversations? Do you often ask people to repeat themselves? Do you hear better in one ear? Do you have frequent pain or ringing? Observation is just as important. Children who don't respond to their names or adults who avoid conversations may already be struggling with hearing loss. When in doubt, refer to ear, nose, and throat surgeons or audiology services or escalate to district or central hospitals. As a healthcare worker, you are often the first point of contact for patients with ear and hearing problems. Your role is crucial in reducing preventable hearing loss. Educate families and communities about healthy ear care, the dangers of harmful practices, and the importance of vaccination and noise protection. Screen patients during routine visits using simple World Health Organization tools, such as the Hear Who app or the primary ear and hearing care questions. Treat uncomplicated ear infections and provide safe first aid measures like dry mopping for ear discharge. Recognize red flags such as persistent discharge, sudden hearing loss, or facial weakness, and refer promptly to higher level facilities.
Advocate for ear and hearing care by including it in local health plans and working with partners to improve access to hearing aids and rehabilitation services.
In short, you cannot provide every service, but by educating, screening, treating, and referring, you can make the biggest impact on preventing permanent hearing loss in your community.
The key message is that much of the hearing loss in Malawi can be prevented or treated. Primary healthcare workers play a vital role in educating families, recognizing early signs, managing simple cases, and referring when needed.
You can help reduce the burden of hearing loss and improve the quality of life for children and adults in your community.